Now I would like to welcome Mr. Trevor to give his presentation. Thank you.
Thank you. Wow, that's really impressive and kind of hard to follow. But I have some great numbers to share with you all as well. So my name is Trevor Turner. I have the privilege of serving as the International Programs Manager for the Starkey Hearing Foundation. And one of the biggest focus areas in the past year that we on the International Programs team have had is trying to improve the scale and quality of our aftercare program. Now, I wear hearing aids myself. I've worn hearing aids for 30 years because I have a severe hearing loss. So I understand personally how important our aftercare programs are to our patients. So I work with our hearing care coordinators every day to improve and create a positive patient experience in our aftercare program. Now, aftercare started in the early 2010s when Tanny recognized the need for a follow-up program in the Starkey Hearing Foundation. And so she began working with our teams to develop it. And in 2014 and 2015, we were really able to start tracking the number of aftercare sessions and really work on honing the model and making it work well for us. And then 2016, we were able to really hit the pedal to the metal so that by 2018, we were able to quadruple the number of recorded aftercare sessions than compared to the year 2014. So. I'm also happy to announce that we're on track in 2019 to far surpass our 2018 numbers. We've already done 150,000 aftercare sessions since January, and the year's only halfway done. So. Now, aftercare, we have three types of services. We have aftercare over the phone, which includes following up with our patients at least twice a year, having a local phone number for patients to call if they have any needs or concerns, and also providing over-the-phone counseling. And we were lucky to, in the past year, since last July, to have done almost 190,000 aftercare over-the-phone sessions since last summer. And then, thank you. And then if our patient needs are unable to be addressed over the phone, then we invite them to come into our aftercare service centers. And an aftercare service center can be, a hospital and a clinic, it can be a classroom at a university, a partner organization's offices, or it can even be in the back of a car for some of the most rural regions. Tanny has some great stories about doing aftercare in the back of a car in the first aftercare sessions. And with our coordinators, we were able to do over 25,000 aftercare service center sessions since last summer. And many of our patients are students, and so we bring aftercare to them. And with the help of teachers and our Starkey Hearing Foundation student ambassadors, we're able to do entire classrooms at the same time. And so our coordinators go to the school and fit the students and make sure that they're wearing the hearing aids and that they understand how to use them. And since last summer, we've done nearly 52,000 aftercare at school visits. So very impressive right there. Now, why do patients come to aftercare? As you can see behind me, aftercare is not so much about the hearing aid and the ear mold, but more about the relationship with the patient and the hearing care coordinator. Over half of our aftercare sessions are counseling and more counseling. As many of you guys in the hearing industry know, patients don't become expert hearing aid wearers overnight. So that's why our counseling is so critical in aftercare. And over a third of our aftercare, general follow-up and batteries and things like that. 14% of our aftercare is hearing aids and ear mold issues. But even then, our hearing care coordinators are expertly trained to solve the problems, find the issues, and get those hearing aids back into those patients' ears so that they can get back to their communities and connecting back to life in their families. Thank you. Thank you. Now, Bill Austin has a saying that it's posted all over this campus, and it's better today than yesterday, better tomorrow than today. And at the foundation, we take that incredibly seriously. So as we have grown as an organization and have been able to increase our capabilities of monitoring and evaluating our program, we're able to highlight areas that we think we could definitely improve. Last fall, we recognized that 78% of our patients receive immediate follow-up care within 2 months of being fit. Now, I think it's an impressive number considering that many of our patients live in incredibly rural areas, incredibly poor areas, underdeveloped areas. So the fact that we're able to follow with our patients in these kind of conditions is impressive in itself. But we didn't take that as an excuse at the foundation. We knew we could improve. So we worked hard with our coordinators to improve the efficiency of our follow-up, quality control phone numbers, and just to make sure, expand our teams and everything like that. And so I'm happy to announce that this summer in June, 97% of our patients received immediate follow-up care within 2 months. Now, those numbers are great, and certainly we're very proud of at the foundation, but what really, really gets us motivated every day is the stories of our patients and our hearing care coordinators. Each month, we get photos and stories of our patients, as you can see coming up behind me. The smiles and the successes is what really gets us excited, and we learn about how patients go back to school, they're able to get new jobs, they're able to hear their grandchildren for the first time, and this is what fills my heart with complete joy. And as somebody who wears hearing aids and depends on hearing aids to connect in my life, I understand this fully. So I want to thank every one of you guys for supporting the Starkey Hearing Foundation and allowing to make all of this